Ooh, ooh.
Good morning. The topic of our today's lecture is instrumental method diagnosis of the cardiovascular disease. We'll stop of the main method examination, which may be used for diagnosis of the heart diseases. And first of all, I want to remember you about principles or order of the diagnosis which are used for the cardiovascular diseases. And first of all, we'll start our examination from physical examination, which includes inquiry, inspection, palpation, percussion, and auscultation. And we remember that inquiry, if it is made with definite order, can give 80% information about diseases, especially for diagnosis of angina pectoris, diseases which diagnose it depending inquiry, specific complaints of the patient and specific characteristic of the heart pain. Percussion widely used to give primary information about size of the heart, because with determination relative cardiac dullness will approximately can assess size of the heart chamber and know about next method examination, which helps to clear primary opinion. Auscultation, one of main method of physical examination, because depending intensity of the heart sound, presence or absent heart murmurs, we can reveal some heart pathology. Intensity of the heart sound indicates about activity of the heart contraction, first of all, and functional ability of the heart valve. And you understand, if the intensity of the heart sound decreases, you can see about decreased activity of the heart contraction or incomplete closing of heart valve. Any problem with heart valve or heart orifice manifested with formation of heart murmur, because its main provoke factors turbulence blood flow, which is audible for our ear. After physical examination and formation of primary opinion about possible pathology, doctor sends the patient on additional examination, and for cardiovascular system, main method of diagnosis are instrumental. We'll use laboratory methods in some cases, but more attention will put on instrumental examination. Every patient which enters in hospital obligatory exam with X-ray examination of chest. First of all, it is needed for diagnosis of the lung pathology, but together with lung we can assess size and shape of the heart. Main method diagnosis for cardiovascular pathology is electrocardiogram method, which record electrical impulses which produced due to high heart activity. Electrocardiogram is the main method for diagnosis of myocardial infarction first of all, and to clear any types of heart arrhythmias. Echocardiography, widely used because it helps to clear size of the heart, its structure, structure of the heart valve, to reveal some pathological elements into the heart. For example, size of the post-infarctive scar, thickness of the heart wall to reveal hypertrophy, or size of heart chamber to reveal dilated cardiomyopathy. Echocardiography with Doppler ultrasound examination clear direction of the blood and helps to clear source of heart murmur, which was revealed on auscultation. Some cases patient needed more deep examination, and for this examination, which used only with definite purpose, not widely as previous method, is Holter monitoring. It is method examination which helps record electrical potential of the heart during some times from 1 to 3 days. Echocardiogram, I said you, widely used for diagnosis of heart pathology. Sometimes we can send our patient on echocardiogram with mapping to reveal functional activity of the heart and clear heart failure. Exercise stress test is obligatory method to reveal functional activity of the patient, especially after myocardial infarction, to clear functional class, to clear degree of the heart failure, and decide questions about walking activity of the patient and or needed immobilization of the patient. Computed tomography also may be used for diagnosis of the heart, especially if we want to examine surrounding organs. It is used for the patient with combined pathology when needed assess structure of heart and lung, for example. When we'll do differential diagnosis of the chest pain, and we must differentiate problem of lung, heart, large vessels, and other predestinum organs. Magnetic resonance imaging examination have more high diagnosis value comparing with computer tomography because its activity higher, but it's not widely used, only with definite purpose. We can use magnetic resonance angiography, especially which is needed for the patient with repeated attacks of the pain when we'll diagnose this angina pectoris, unstable angina pectoris, to prevent myocardial infarction and decide questions about stent correction of the coronary vessel to prevent the obstruction. Coronary angiography is invasive method which may be prescribed for the patient with coronary syndrome, with prolonged or often repeated attacks of the chest pain. When we'll do differential diagnosis between angina pectoris and myocardial infarction, and result of coronary angiography helps the doctor to decide question about tactic of treatment. Will be therapeutic measures which may be enough, or patient needed some surgical correction, for example stent treatment to prevent obstruction of coronary vessels and hold the patient from myocardial infarction, more grave manifestation of ischemic heart diseases. Coronary ventriculography helps assess condition of heart chambers. Sometimes it is needed to reveal some complication of the patient after myocardial infarction. Pulmonary angiography may be prescribed for the patient with combined pathology with chronic lung diseases when will be formed pulmonary heart, and will be some problems with lesser circulation, and to clear pathology and again decide question about possible surgical correction, we can use some invasive method because all last methods are invasive. I'll show later the principles. No, I said you, X-ray examination not especially prescribed for diagnosis of the heart, but every patient which enters in hospital obligatory examined with X-ray examination of the chest. First of all, to reveal pathology of the lung, but it's impossible without assessment of the heart. And if you see on this graph, you see that heart slightly widened, especially due to displacement of the left ventricle. You studied on practical classes heart percussion, and you know that left body which is formed with lateral side of the left ventricle normally localizes medially from the left mid-clavicular line. If you see on this graph and approximately built mid-clavicular line, you see that heart localizes 1-2 centimeters inside. If you see on this graph and put mid-clavicular line, what do you see? You see that left ventricle displaced laterally due to its hypertrophy or dilation. We cannot decide this question depending on X-ray examination. We can only assess that left heart chamber widened and heart bodies displaced. It helps to clear your primary physical examination opinion after heart percussion. Then, if you see on the waist of the heart, you see some problem with aortic arch. Normally, it cannot be such visible. It must be more flat. If you see its protrusion, it may be a result dilation of aorta or it's some atherosclerotic affection. No, it is X-ray apparatus which helps record chest examination. Patient may be examined vertical or horizontal position. It depends from the functional or other characteristic of apparatus, from the purpose of examination, no, from condition of the patient. If the patient cannot get up and stand long time, for example, there are group of the patient with heart failure, we can examine his horizontally. If you see on this graph, you see that heart resembles ball-like configuration of the heart, which is called mitral heart configuration, which is characteristic for the patient with mitral heart defect, mitral stenosis, and mitral regurgitation. Such configuration of the heart appears due to hypertrophy of the right and left ventricle and left atrium. As a result, heart loses its waist and resembles ball. And if you approximately put the line along 8 of the sternum, you see that right ventricle displaced laterally. If you put mid-clavicular line, you see that left ventricle also displaced laterally. Both ventricle hypertrophied in case of mitral regurgitation, and only left atrium and right ventricle patient with mitral stenosis. Ball-like shape of the heart is called mitral heart configuration, which indicates about mitral heart defect. If you see on this graph, you see that right ventricle normal, because if we'll put line along 8 of the sternum, we not see displacement of the right ventricle. But heart resembles shoes-like configuration. Has specific name aortic configuration of the heart, which appears due to significant displacement of the left heart body due to hypertrophy left ventricle. If you put mid-clavicular line, you see a significantly heart displaced to the left, which is characteristic for the patient with aortic heart defect, aortic stenosis, and aortic regurgitation, because in both this pathology, left ventricle overloaded with pressure in aortic stenosis or with volume in aortic regurgitation, and in both cases, this situation needed more active heart contraction, which compensated with hypertrophied left ventricle. you see result of X-ray examination, which give you information about size and position of the heart in the chest. Electrocardiogram is main method of the heart examination, without which impossible any diagnosis. And before new methods such as echocardiogram, computer tomography, magneto-resonance imaging test, electrocardiogram was main method examination which helped reveal hypertrophy of the heart chamber, its functional activity, and any other pathology. Now, we'll take from electrocardiogram protocol, first of all, information about cardiac rate, rhythm, and it is main method for diagnosis myocardial infarction. You studied electrocardiogram on the classes of physiology, and you know for recording electrocardiogram we'll use special apparatus which interconnected with patient with electrodes. Now you see chest electrodes which are placed along topographic line from the right sternal line, and then 6 electrodes continually placed along all next left topographic line before mid-axillary line to record potential, electrical potential of the heart from definite side of myocardium. No, for example, first and second chest electrode record potential from the right ventricle, if you remember anatomy. And our practical classes of heart percussion, you know that heart projected on the chest mainly with its right ventricle. Third chest electrode record potential from intraventricular septum, then heart apex, and fifth and sixth take potential from lateral part of the left ventricle. It is especially needed for topical diagnosis of myocardial infarction because doctor must know size, width, and depth of the necrotic foci to give correct treatment and know prognosis for the patient, and then prescribe him some rehabilitative method. And then more lead on the electrocardiogram with pathological indices, then more wide and deep size of necrotic foci. Now, to interpret electrocardiogram, you must be informed about main its elements. We distinguished wave, positive P, R, and T, to negative Q and S. Will interpret ECG depending of amplitude and width of the wave, because we know that P wave indicate activity of atrium, and if any problem with P wave, first of all we'll find pathology in atrium. QRS complex is main complex on ECG because it appears due to contraction of ventricle, and R wave, on contrary from other wave, will never change its polarity. It may be only positive, and its amplitude indicates about activity of heart contraction. Any problem with QRS complex show problem with heart ventricle. Its width indicates about activity conductive system. T wave indicate process of repolarization. Other word, after active systolic period, first of all will be systolic relaxation, during which will be change polarity of myofibril, because every time polarity of myofibril will change, outer or inner surface of cells may be positive or negative, and depending its polarity will be dependent excitation of the heart, transmission of impulses, activity of conductive system, and as a result, activity of heart contraction. After which heart completely relaxed, we are talking about diastolic period, horizontal line between P and P wave, which is called isoelectrical line, and its lengths show lengths of diastolic period, which significantly shorten it in case of tachycardia and prolong in case of bradycardia. More completely, we'll stop on principles interpretation of ACG next course, because next course our lectures will start it from principles interpretation of electrocardiogram and revealing some pathological indices, and first of all diagnosis of different types of arrhythmia. Echocardiography, I said, you give more full information about structure of the heart, because first of all it assesses density of heart muscles. It helps clear size of the heart chamber, thickness of the heart wall, because if the X-ray examination show only general shape of the chest and show that left or right ventricle displaced from normal position, but only echocardiography helps you to clear it is due to hypertrophy, because compensatory growth of heart muscles and thickness of its wall, or due to dilation, because diastolic overloading of the heart with blood volume. In this case, heart chamber widened, but its wall becomes thin, and it is possible assess only with echocardiography. You see thickness of the heart wall. You can assess structure of the heart valves, and if you see on this graph, you see that heart fixed during diastolic period, because open a mitral valve and blood can go from left atrium into the left ventricle, and close aortic valve to prevent abnormal blood flow, to prevent regurgitation. If you see, for example, opened left atrioventricular valve and aortic valve also, it can indicate about mitral or aortic regurgitation. These graphs help clear thickness of the heart wall. Doppler echocardiography, write your information about heart activity, and first of all it is used for assessment of hemodynamic, because it shows direction of the blood flow. And if you see on this graph, again, we examine heart and we see heart during diastolic period, because open atrioventricular valve, which is left atrium, left ventricle. We are talking about mitral valve, which open, and blood will go from left atrium into the left ventricle. Active filling of the heart chamber with blood. But what do you see? You see additional abnormal blood flow from aorta, because semilunar aortic valve incompletely closed, and from small slit blood flow come back into the left ventricle. You see patient with aortic heart defect, aortic regurgitation. If you remember previous slide, when the aortic valve must be completely closed when opened, mitral valve. In this case, we see both valves not closed, but each is normal opening, each is pathological incomplete closure of aortic valve. Patient with aortic regurgitation. Sometimes, depending from the functional characteristic of apparatus, we can see blood flow, which may be dark, white, or black color, or maybe colorated. Sometimes normal blood flow with bluish, abnormal with red, or maybe opposite characteristic. No, if colorated blood flow, it helps the doctor easily reveal some pathological symptoms. Doppler echocardiography maybe diagnosis with specific graft, and if you compare result examination health people and patient with mitral stenosis, depending of peak, which indicates blood flow through the mitral orifice, you see that this patient has widened abnormal blood flow, which is characteristic for the patient with mitral stenosis and indicates turbulent movements of the blood, which will be auscultated as diastolic murmur. And you see this problem recorded during diastolic period and intensified at the beginning of systole, when active contraction of atrium which push blood through the narrowing mitral orifice. If the blood goes with pathological turbulent movement, peak of the wave, which indicates its flow, change its shape. Let's compare Doppler echocardiography patient with mitral regurgitation, heart defect, which is characterized with incomplete closure of mitral valve during systolic period, because during systolic period blood can go only into the aorta and pulmonary trunk. You see right ventricle closed to prevent comeback blood flow, but left ventricle incompletely closed, and together with aorta, blood come back into the left atrium. You see pathological peak, which indicates turbulent blood flow into the left atrium. Let's see on echocardiography patient with aortic regurgitation, which is comeback blood flow through the unclosed aortic orifice. We saw this echocardiogram without graft, only on the heart chambers. But if we record graft, it shows pathological turbulence movements of the blood, because normally we must see blood peak only lower part of the graft, below of horizontal line. If you see some peak of the blood above, it indicates pathological turbulence movements of the blood. Holter monitoring is used in case diagnosis of some arrhythmias and ischemic heart disease. For example, patient complains of arrhythmic heart contraction. Doctor auscultate patient, no problem, heart contracted regular. No, how long do you auscultate one patient? Approximately in polyclinic, for every patient, doctor has 12-15 minutes during which he must do full examination of patient from inquiry to auscultation, examine all organs and prescribe primary treatment and some additional examination. For heart, maybe some minutes. No problem with heart rhythm. A patient has complaints. We must clear each is true or false. We'll send patient on electrocardiogram. Electrocardiogram recording also 3, maximally 5 minutes. Again, you see no problem. Rhythm is regular. How can you exclude or clear some pathology? You send patient on Holter monitoring. We'll put some electrode on definite sites of the body, fix them, and all information will be held in portative apparatus and will record activity of the heart during long period which is needed for the doctor. Maybe 1 day, maybe 2, 3 days. Together with electrocardiogram, recording of electrical potential of the heart, and we showing time during which it is recorded, apparatus will control blood pressure, and Holter monitoring helps clear when patient does have more problem during daily period, during night period, because if the patient complains of repeated attacks of the heart pain during night, no, to clear he only must call emergency aid. It's sometimes impossible, and every day patient cannot call emergency aid. We'll put Holter apparatus, and after some days doctor interpreted long tape of electrocardiogram with result of heart contraction. We can reveal some arrhythmias if they present it. We can assess activity of the heart contraction and can reveal attacks of ischemia because during spasm of the coronary vessel will be change shape of T wave, will be recorded displacement of ST segment, and then more often will be recorded this problem, then more severe, more heavy pathology of the patient. And doctor can determine tactic of the next treatment. And Holter monitoring helps clear present or absent arrhythmias, because if the patient feels arrhythmic heart contraction, Holter monitoring not reveal any arrhythmic contraction, it shows that patient can have problem with psychic because he feels or his sensitivity not correlated with definite objective situation. And except cardioprotective medicines will prescribe patient some psychic medicines to record his sensitivity. Holter monitoring. Now widely used, especially in childhood period, maybe when maybe some functional disorders which needed some doctor's correction. You see portative Holter apparatus. I said you, we can put electrode on the some points of the body. They fixed. It's not significantly discomfortable for the patient, and doctor have full information because all information from portative apparatus then recorded on computer and maybe easy interpreted. exercise stress test. At the beginning of our lecture, I gave its characteristic and I said you exercise stress test, first of all, widely used in coronary department, especially after myocardial infarction to assess functional activity of the heart and reveal some complication after myocardial infarction, determine time period of rehabilitation. Exercise stress test may be used for diagnosis angina pectoris because I said you angina pectoris first of all established depending of inquiry of the patient. Patient complains of specific chest pain behind the sternum, which has constricted heaviness character, appears after physical or emotional excitation and faster disappears after taking nitroglycerin. No, for example, patient feels pain at home. Will be some changing on ECG, but it must be recorded immediately during attack of pain. Patient calls the doctor, not take nitroglycerin, but sometimes coronary spasm released independently at the rest because patient cannot continue provoke factors because it may be finished with myocardial infarction. Patient feels pain, he immediately takes nitroglycerin. After 5 minutes, problem disappears, coronary vessels relaxated, coronary circulation restored to normal, and if we record ECG during this period, no problem, it will be nearest normal. Only when ECG recorded period of attacks of pain. It is possible only if the patient in hospital nearest apparatus. For this purpose, we can use Holter monitoring or we can use exercise stress test. Patient you see interconnected with electrocardiograph which result recorded on monitor of computer. Obligatory will control blood pressure and then will give the patient depending of his age, sex, weight, definite physical loading and control result. And if you see that definite physical loading adequate, not intensive, accompanied with disordered result on ECG, we can see displacement of ST segment or changing of T wave, or patient feels discomfort in the heart region, or will be non-adequately increase heart rate or change blood pressure, it will be assessed as positive exercise stress test and you have objective result of ischemic heart diseases, for example, angina pectoris. After myocardial infarction, will also control patient vital and working activity dependent exercise stress test. We can give him minimal physical loading which is needed for usual life activity. If it's comfortable for the patient, we can increase physical loading to assess response of the heart on any physical loading. And we can decide and can give the patient some protective recommendation. Can he completely come back to normal life before disease? for his work which was made before myocardial infarction, or patient must change profession, or sometimes his working activity significantly restricted. Exercise stress test may be prescribed during period of rehabilitation, sometimes after myocardial infarction, before discharge of the patient from hospital, after sometimes from discharge, to assess vital and working activity of the patient. Imaging stress test. It is method which record activity of coronary circulation, also after some physical loading, which will be fixed with photograph, and you see that area with normal blood flow, and you see area which colorated with specific bluish color, which shows reduced blood flow due to obstruction of coronary artery. And then more bluish area will be recorded, then more heavy condition of the patient. But this apparatus may be absent in some clinic, in usual clinic. It may be only in specific medical institution and not widely used for diagnosis. More easy used treadmill test when we'll give patient special physical loading and record result with apparatus. Sometimes patient can be examined in definite department. If you go along cardiovascular department, I think you not work in hospital. In next course, I think we come back in 7 hospital where localizes our department, and will obligatory go with you in cardiovascular department, and you see that along corridor presented some mark which shows length of distance, and doctor can assess patient functional activity when he asks him, for example, walk slowly and control before and after, pulse rate, blood pressure, then more fast walking, 100 meters or 300 meters, and depending result of cardiac rate and blood pressure will approximately can assess his vital and walking activity. Computer tomography. No, I said you, this method widely used if you think about, first of all, combined pathology. When, for example, we do the differential diagnosis of the chest pain, because it's not specific, and doctor confused to clear it is heart, or it is both heart and lung, or it is any other pathology in three-dystenium, but which manifested with heart problem. You see on some level of the heart, you see some problem in coronary vessels. You see obstruction of coronary vessels, which explain you attacks of the heart pain, because patient with angina pectoris due to atherosclerotic affection of coronary vessels. Magnetic resonance imaging test, on contrary from computer tomography, has a low ionic radiation because it is magnetic resonance, but it's also not a routine method examination, because this apparatus needed specific a room, specific doctor, and sometimes it is possible only for large hospital or on specific medical institution. But its diagnostic value is slightly higher than computer tomography, and it may be used for the patient with ischemic heart disease, patient after myocardial infarction, or for diagnosis of some specific rare pathology of the heart, for example, growth of tumor, because it's not a wide problem. No, for example, you see result of magnetic resonance therapy, which resembles photo of computer tomography, and it helps reveal some problem into the left ventricle. No, you can compare normal picture, which must be, and you see here together with normal we see pathological spots, which appears after myocardial infarction, may be result of post-infarctive scan. Magnetic resonance imaging test may be used as non-invasive coronary angiography, because you saw we can assess coronary vessels to reveal site of the obstruction and as a result disturb blood flow. But again, remember you needed special apparatus, needed special doctor which have knowledge of this method examination. Invasive coronary angiography used in special surgery cardiovascular department. It may be prescribed of the patient with attacks of cardiac pain, repeated, prolonged. We are talking about case of unstable angina pectoris, when the doctor must decide question about possible surgery correction of coronary vessels. And with this purpose, we can use invasive coronary angiography when we'll introduce special medicines into the coronary artery, which is possible when we catheterize peripheral vessels. Usually it is subclavian vessels, it is femoral artery, it is brachial artery, through the which introduce catheter, and will introduce special medicines which helps assess lumen of coronary vessels. Now you see sites through the which may be introduced catheter and medicines. Usually it is femoral artery, maybe brachial artery, maybe subclavian artery. We can catheterize heart through the vena cava and catheterize right ventricle. This method may be used for diagnosis and for treatment. For treatment, when we introduce special electrode and stimulate heart contractive ability. Now, if you see on this graph, you see that significant mass of coronary vessels slightly or completely invisible. Why? Because contrast methods cannot go into the coronary vessels. You see direction of catheter through which introduce special method in the coronary system, and we can assess diameter of coronary artery. You see as poor circulation of this side of the heart, and you easily understand why your patient come back to you with repeated heart pain. Patient cannot go out from house because feels severe pain. He can only sleep, sit, sometimes eat. And this patient obligatory needed in surgical correction of coronary vessels. Also, you see obstruction of coronary vessels and lack of blood flow through the coronary vessels. Patient will be recommended surgical correction, transplantation of stent, which is special construction which introduced into the coronary vessel and hold it from spread. And you see, will come back diameter of coronary vessel to its initial level. We prevent abnormal constriction or obstruction of coronary vessel and hold the patient from acute coronary situation such as myocardial infarction. Sometimes we can use radionuclide scanning. When into the vein, we'll introduce special methods which mark which are radionuclide elements, which then it will be controlled with special gamma camera. Gamma camera will put apparatus over some sides of the heart and depending keeping of medicines into the heart. We can see special photo which help assess activity of the keeping medicines. It depends from activity of coronary circulation, and radionuclide scanning may be used for diagnosis ischemic heart disease, diagnosis of angina pectoris, and also help decide question about next order of treatment. But you understand this method needed special room, special apparatus, special doctor, and it cannot be widely used only in specific medical institutions. More widely will use electrocardiogram and echocardiogram. There are more wide methods which are used in every cardiovascular department and becomes routine because prescribed for every cardiac patient, and which helps clear main pathology of the heart. If needed some atypical, rare diseases, we may use more wide method examination about which I said you today. No, you understand our technique, our medicines develop and go upward, and at the end of our institute or at the beginning or during your working, your knowledge will be widened and you can use and meet with other method examination. Some method go out, other method widely used. It depends from development of our scientific activity. Today was last lecture. I gave you all material which may be needed you for this period. We'll continue our lectures next year. We'll continue to talk about diagnosis of cardiovascular system because you informed that this year you have one control point of cardiovascular diagnosis, and next year you will have two more control point of diagnosis of the patient with cardiovascular pathology. I'll remember you to finish second course in time. You obligatory must have positive mark of control point, 3 practical control point, inspection, examination of pulmonological and cardiological patient, and fourth control point, it is a result of your case report. Short variant, only part of the case report, which includes inquiry and inspection. And students which will close 4 control points can finish our course in time, can go to summer holidays and come back on third course without any problems. Thank you so much for your attention. Will be health, and I think we'll meet with you next year and continue our education. Goodbye.